Rates of arthritis are increasing these days, with an estimated 50 million adults now believed to have the condition. The most common symptoms are joint pain and stiffness, but we may be able to prevent it or slow down some of these types of arthritis. Joining us now is board-certified rheumatologist Dr. Assil Saleh with Foxhall Internists this morning. Thanks for coming in. It was fascinating to talk to you beforehand, realizing that arthritis, you said, is just such an umbrella for, would you say, like hundreds of types of arthritis?
That's exactly right, Sarah. So it's a generalized term for more than just the typical wear and tear osteoarthritis that we all are familiar with and relate to. But it includes a lot of other rheumatic conditions or inflammatory conditions like arthritis from rheumatoid arthritis, with lupus, with psoriasis, celiac disease, Lyme disease. So it's a very generalized, encompassing term.
Okay, but as you had mentioned before, the most common type is osteoarthritis. And this is one that's really on the rise. 1 in 5 adults that have it, is that correct?
That's exactly right.
What is the reason behind this, the causes, and why is it on the rise?
Well, osteoarthritis is generally thought of as wear and tear of the joint. There is a certain amount of inflammation there too. The most common risk factor is being overweight or obese. And that, as we know, is also on the rise in this country. So if we think of 1 in 3 adults are either obese or overweight, that itself can lead to an initiation and progression of osteoarthritis. Which
kind of leads to the, this is the type that you could possibly prevent, because obesity is something we can control. It is in our realm of control.
Exactly. We can control. If you think of each 1 pound of weight, it exerts about the equivalent of 4 pounds of pressure on a joint. So it's something that's totally preventable and certainly reversible.
And I know we have some tips on how to prevent arthritis, if we could put them up there right now. Control your weight is the one we mentioned. Also staying active, which, I think some people think, well, if I have pain in my joints, should I be staying active?
Definitely. I think the more active the joint is, the happier it is. Now, we're not talking about hard impact exercises. We're not asking you to go running, but walking, simple as go out and walk 20 to 30 minutes a day, 4 to 5 times a week. So if there was one message that we have out there, is get out and walk.
And the other thing I noticed on there was eat an antioxidant-rich diet. What does that do?
There's a little bit of controversy about that. There has been some evidence that, for instance, turmeric can be associated with improvement in joint pain in some rheumatoid arthritis patients. Avoiding red meat, for instance, can be associated with less arthritis. Eating berries can be associated with improvement in pain in some arthritis patients. But overall, eating a well-balanced, healthy diet is always a good idea.
Okay, of course. And learn to relax. Easier said than done. And how does this really help us prevent arthritis?
In many ways, particularly in the case of, for instance, autoimmune-related arthritis. We know that stress can trigger autoimmune disease. That is a very well-known fact, whether it's physiologic stress, emotional stress. So take a step back, take a deep breath in, and recognize your situation and try to act upon it and not allow stress to be such a big part of your life.
And also, I think a lot of people think of genetics playing a role in a lot of this as well. Do you need to be really mindful of that if there's somebody in your family that's had it? And if so, is there a way to prevent it, depending on, I guess, what type of arthritis?
You're absolutely right. It's very, very important to be aware of your family history. So if there is any family history of certainly autoimmune disease like lupus or rheumatoid, or even osteoarthritis of the hands, for instance, mom may have osteoarthritis of the hands, be mindful of it, be aware of it. So if you ever develop any joint pain, swelling, inflammation, go to see a rheumatologist sooner rather than later, because these conditions, if treated early, have a much, much better outcome.
And I know you mentioned, too, high impact can also be, if you're doing a lot of high impact working out, someone that's like the running you talked about, or anything that takes pounding, that can also cause it.
That can cause it, certainly if the joint is already injured. So, for instance, we know that a lot of people who have ACL tears, anterior cruciate ligament tears in the knees, not all of them, but a lot of them go on to develop osteoarthritis of the knees, for instance. So these people who have prior injuries to their knees should really be mindful of the type of exercise they can do once you have an injury in a joint. Isometric exercises are much safer. So it's an exercise where you don't move your joint, but you're still strengthening the muscle, and that will take the pounds or the weight off the joints. Those are very important and very helpful in strengthening your muscles and help protecting your joints.
All right, Dr. Assil Saleh, board-certified rheumatologist with Foxhall Internists. Thank you. So much information I didn't know about arthritis. It's been enlightening. We appreciate it.